The official flag-off ceremony and two-day workshop of the Arm Our Youth campaign by the OCI Foundation, held on Tuesday, 10 September 2019, was historic as it heralded the commencement of the statewide implementation of the inclusion of breast and cervical cancer preventive techniques in the secondary school curriculum. The event, sponsored by the Onyebuchi Christi Federal OCI Foundation, held at the main auditorium of the Nnamdi Azikiwe University, Awka, attracted eminent personalities from diverse walks of life, including the Vice Chancellor of UNIZIK, Professor Charles Simone, state government functionaries past and present, the traditional ruler of Nsugbe, Igwe Victor Ntoka, and that of Umuoba Anam, Igwe George Ekwalo. Others were the representatives of the World Health Organization (WHO), heads of institutions such as the Post-Primary School Service Commission, school principals, captains of industries, and some members of the Nollywood industry, among others. The Arm Our Youth campaign, according to the president and founder of the OCI Foundation, Associate Professor Christi Fedora, is a flagship health initiative of the OCI Foundation designed to be a wide-reaching, sustainable, and a cost-effective way of spreading anti-breast and anti-cervical cancer messages to Nigerian women, which targets students across all senior secondary schools in Nigeria, beginning with Anambra State.
The Arm Our Youth campaign is the flagship health initiative of the OCI Foundation, designed to be a wide-reaching, sustainable, and cost-effective way of spreading breast and anti-cervical cancer messages to millions of at-risk Nigerian women in a way that is timely, efficient, and culturally acceptable. Primarily, this campaign targets students across all senior secondary schools in Nigeria by introducing the relevant teachings into their regular academic curriculum, along with assessment and examination systems.
The chairman of the occasion, Professor Kate Omenua, who is the Commissioner for Basic Education in Anambra State, represented by Dr. Ray Ofo, described the Arm Our Youth campaign that is taken off from Anambra State as another fruit of the Think Home philosophy of Governor Willie Obiano, where an Anambra-born medical doctor who is based in Australia has brought home his ideas and knowledge in the health sector to better the life of Ndi Anambra in particular and Nigerians at large. Professor Meno, who is also an official sponsor of the Arm Our Youth campaign, noted that breast and cervical cancers are critical health challenges ravaging women in our society and enjoined all stakeholders needed to drive the Arm Our Youth campaign initiative to help in reducing the burden of these deadly diseases by spreading the preventive techniques far and wide.
Irrespective of the fact that he's in faraway Australia and he thinks about us, he feels for us, and has come down to assist us as much as he can under the auspices of OCI Foundation. I salute you, sir, for this great and a milestone intervention in the health system. Permit me to use this opportunity to observe that the cervical and breast cancers are major challenges of health care, particularly in developing countries like Nigeria. Studies show that cervical cancer is the fourth most frequent cancer in women worldwide, most common in developing countries like Nigeria, particularly among women aged between 15 and 44 years.
A poem for the OCI Foundation's president by Ms. Lebechi Ezenaya, as well as a rendition of the Arroy campaign featured.
I know a legend who lives for all mankind, whose cheer arouses from the smiles of the impoverished. His acts of philanthropy never ceases to exalt his legacy, be rise by lifting others. He is to be remembered forever. I know a king whose ornateness radiates vehemently, whose words are reliably soothing, sacrosanct and succinct. He is a true leader.
I have eyes into armor. I am not just a child. I am the future's mother. Even the future's grandma. The first host of holy lands on earth. I'm a soul, I'm a snow, I'm a young, I'm a soul, I'm a snow.
Presenting his address of welcome, the president and founder OCI Foundation, Associate Professor Chris Ifediora, disclosed that the AROI campaign is a unique, novel, comprehensive and engaging health education campaign that is evidence-based and endorsed by the Harvard Medical School, USA, as an anti-breast and anti-cervical cancer health promotion initiative to be introduced in all senior secondary schools in Nigeria from the 2019-2020 academic session. The OCI president observed that the program is a follow-up of the Foundation's 2 years of annual health symposium on breast and cervical cancer's preventive techniques in parts of Anambra State, Nigeria.
The Annual Youth Campaign is novel, it's an invention. It is comprehensive in its packaging, it is engaging in its delivery, and it is unique in its offering. It is unique because, to the best of our knowledge, it's the very first campaign anywhere in the world to target young women in their mid to late teens while in our formal academic settings. It is unique because it's the first to have the teachings that will be repeated multiple times over a number of years for the same cohort of students. Along with its inbuilt assessments and examination system, this feature improves engagement from the participants and will guarantee long-term sustainability of the lessons they gain.
He also reiterated the OCI Foundation's commitment to reach out to everyone that can assist in driving the vision of the AROI campaign, with the hope that within the next 20 years, the mission of arming our students young will be actualized with the support and partnership of anyone, any group, and all interested bodies to be fully implemented in Nigeria. He also explained that the burden of the scourge of cancer is high in Nigeria, wherein about 14,000 Nigerian women diagnosed with cervical cancer every year. Over 8,000 will die.
Even though we may not have the financial or political wherewithal to complete the tasks by ourselves, we at the OCI Foundation surely do not lack the courage, nor the dedication, nor the commitment, nor the skills to complete this task. Ladies and gentlemen, at the OCI Foundation, we do not just dream. We work hard to make our dreams happen. So please permit me to invite us all to a 20-year journey into the future of this campaign. Let us all imagine this. In about 20 years from now, we'll have an Anambra State where the Annual Youth Campaign would have been in operation for about 2 decades. And in Nigeria, where the campaign would have existed for at least 15 years. In 20 years' time, the senior school students of today, who are mostly in their mid-teens, will be in their mid to late 30s. Majority of them will be parents. Some of them would have their own families, and some will be involved in either the policy making or policy implementation across the Nigerian nation. In 20 years' time, there will be tens of millions of under 40-year-old Nigerians who will be well versed on the preventive strategies, the early symptoms, and the risk factors of breast and cervical cancers. These Nigerians and those associated with them in any way will be well armed to know when to seek for help without waiting till it's too late.
Presentation of certificates, unveiling of the OCI AROI sponsors, champions, ambassadors, and partners followed with the goodwill messages from the recipients.
First, I want to say welcome to Nnamdi Azikiwe University. No. This campaign, when he spoke to me, and sent the information through WhatsApp. It was through WhatsApp we were communicating, and at the point through email. I quickly scanned through the objective because sometimes we're waiting, to identify with certain people come with bogus idea. But I just went through within the first 5 minutes, and I called him back. I said, yes, I said, this is very, very, very innovative. And I said, take my words before I see your official, letter and other thing. Just take it from me that UNIZIK is officially partnering with OCI Foundation.
He prepared very, very well, and I told him, count on me, that I can never partner with a program and go halfway. I will see it to the end. More so when it concerns saving life. More so when it concerns the students. And I am proud of PPSSC because we are pacesetters.
I'm really delighted to receive this award from OCI Foundation, and I must say that the visionary president of OCI Foundation in the person of Professor Chris Ifediora has been wonderful. In fact, I can't believe I'm just seeing him for the first time because he is so dogged, he is a master planner, and he really strategizes and synergizes the activities of the foundation.
May I use this opportunity to thank the president of this foundation. Doctor, thank you very much. Once you have the teachers and the principals, you don't have any problem. The course you want to achieve in the schools, be rest assured that they are going to make sure that the students are well impacted with the knowledge of this cervical cancer and breast cancer and how it will be prevented.
We will do our best through our own effort to ensure that we educate people out there. We'll post on our Instagram and whatever social handle that we use, and I'm sure we'll touch a lot of lives.
I want to congratulate the OCI Foundation for this laudable initiative focused on the health of our young people. And then WHO is particularly delighted that part of the focus of the foundation is really on prevention of breast cancer and cervical cancer. As we all have heard in the statistics reeled out during the chairman's opening remarks, as well as the address of welcome by the president, cancer, particularly these ones in focus, are among the top killers globally as well as locally in Nigeria. So a laudable health initiative such as this one, being championed by the OCI Foundation, is something really, really worthy of commendation. And that is why the World Health Organization has chosen to identify with this foundation. Personally, whilst sitting at the back, I've downloaded the app, the Savvy Breast app, and it looks very well designed and easy to use, and I think it's quite innovative.
He is in support of what the foundation is doing. The purpose of the foundation is to reduce to the barest minimum or even eradicate breast and cervical cancer, and I think that's one of the things that NGOs should fight for. So I believe that SHIF is the kind of cause that SHIF supports, and this is the kind of cause that SHIF always partner.
We appreciate the recognition given to us today by the OCI Foundation. ABS is glad to partner with the OCI Foundation. We have already started doing what we can do for them, which is helping them to share the message of Arm Our Youth campaign to the Anambra. We've given them reasonable airtime and we will not relent. We'll continue to help them get to the grassroots, get to every girl in every community
in the 179 towns in Anambra State. We are glad to partner with the OCI and we will never relent.
This is one course that we all have to lend our popularity to, our credibility to. Then another thing on the flip side, which is the government side, perhaps you might know because the former Honorable Commissioner for Health is here. Anambra State government has set up the health insurance scheme, which the government wants everybody who is Anambra or who lives in Anambra to key into, so that when issues like this come up, they can also team up with your organization to be able to offer treatment, perhaps free of charge, to those people who are despondent or who need such treatment.
Nollywood is in support of what you're doing, sir. Whenever you need us, just call on us. Thank you.
Meanwhile, one of the Seifert scholars, Master Victor of Awka, who is a student of Chukwuemeka Odumegwu Ojukwu University, extolled the OCI president for his vision of lifting the life of young Nigerians through their educational, health, social and public welfare promotion projects.
To show my sincere and personal appreciation, this great umbrella of hope, their immeasurable effort as board of members, whom I must commend and acknowledge that they have proven that success relies on teamwork. They are men and women whom have sacrificed on both times sleep, sometimes joy and ego, for the betterment of humanity.
Everything that you want to go.
Commenting, the traditional ruler of Nsugbe, Igwe Victor Ntoka, expressed happiness with what Associate Professor Ifediora and his team are doing to promote the health and education of Ndi Anambra, describing it as a strategic health intervention since cancer affects all regardless of one's social status.
So
Unveiling of the OCI Savvy Breast app by the Foundation's president also featured.
I invite us all to be champions of this campaign in our own little ways. Let us all inform our family and friends. Invite them to download the OCI Savvy Breast app. And not just to download them, but to share them with all their friends and contacts at their workplaces, at their schools, the churches, the mosques, and most importantly, social media. By doing this, you would have all partnered with the OCI Foundation as we rise by lifting others.
The legal advisor of the OCI Foundation, Barrister Onyechi Ononye, in a vote of thanks, commended all that attended the flag-off ceremony and assured them that the foundation will deliver what it promised.
I don't know where to start and where to end, but my job is very simple. May I thank all of you for being here today. May I, in a special way, thank the founder, OCI Foundation, Dr. Chris Ifediora, Associate Professor. Thank you so very much. And all other members of the OCI Foundation, and you that are here today, thank you so very much to be here. And in a note, may I also tell you that you must have to key in what the OCI Foundation is doing. Last time we were at the APS for a program, someone called a man and saying, how do these affect us? We do not have cervical or breast cancers. So I want to sound a warning to all of us men here we are also involved in this because we have our daughters, our wives. We have to get interested in all we are saying and in all we are doing.
Some participants at the flag-off ceremony spoke glowingly about the Arm Our Youth campaign. Meanwhile, the two-day workshop for civic education teachers in the government-owned secondary schools in Anambra State, who are to implement the ROI campaign in the schools, was also held at the main auditorium of UNIZIC, Awka. The teachers from the 6 zones of the Post-Primary School Service Commission in the state were divided into 2 for effective training workshop, where Otuocha, Agwata and Awka zones participated in the first day, being 11th September, while Onitsha, Nnewi and Ogidi zones participated in the second day, being the 12th of September 2019. The desk officer PPSSC Awka and the secretary OCI ROI Campaign Planning Committee, Mrs. Sabina Ndigwe, intimated the participating teachers of the essence of their participation. The first lecture, featuring the introduction of facts and the rationale behind the ROI campaign, was delivered by the OCI president and founder, Associate Professor Chris Ifediora, which features the justifications for the intervention at Nigerian senior secondary schools, the level of cervical and breast cancer burdens, and some notes about the Savvy Breast app.
Why are we here? Arm ourselves and equally arm our students for to enable us prevent breast and cervical cancer. Who are those here? We have the civic education teachers and the vice principals academics for schools that do not have civic education teachers. Why civic education? Because civic education is a compulsory subject. You are going to be trained on breast and cervical cancer.
The second lecture on cervical and breast cancers by the Deputy Chief Medical Advisory Council of Chukwuemeka Odumegwu Ojukwu University Teaching Hospital, Amako, Dr. Nnamdi Azikiwe focused on the risk factors, signs, symptoms, and comprehensive approach to the prevention of cervical cancer, with details of the causative virus, vaccination, and screening models. In the segment on breast cancer, Dr. Azikiwe also talked about the preventive techniques of breast cancer, useful facts about breast cancer, and its major risk factors, among other vital lessons.
Cervical cancer, breast cancer, why is it important? To us in Nigeria, we're about 200 million people. The figures we are even seeing are not 100% correct, because in many cases might end up in the hospital, so they are not diagnosed and they are not counted. Or when they get ended up like Dibia, when they get ended up no full pastor, one them paga joy well and paga no. So it's the 4th most frequent cancer in women worldwide, with cervical cancer. But then it is the 2nd most common in developing countries like Nigeria. It is a challenge among women 15 to 44 years. It is something that should be given attention. It's not just an element. Now, we want to talk about something, cervical cancer risk factors. Now, risk factors are not exactly the same as causes.
Dr. Azikiwe also took time to teach the participants about the OCI Savvy Breast app and how they can easily access it from their Android phone Google Play Store. Breakout sessions offer the participants ample opportunity to assess their learning and to make inputs to the implementation of the campaign.
Cervical cancer, breast cancer, why is it important? In Nigeria, we're about 200 million people. The figures we are even seeing are not 100% correct because in many cases might end up in the hospital, so they are not diagnosed and they are not counted. Or when they get ended up like Dibia, when they get ended up the full pastor, also have one name Paga Joywell and Pagano. So it's the fourth most frequent cancer in women worldwide, with cervical cancer. But then it is the second most common in developing countries like Nigeria. It is a challenge among women 15 to 44 years. It is something that should be given attention. It's not just an element. Now, we want to talk about something, cervical cancer risk factors. Now, risk factors are not exactly the same as causes.
Having gone through the lesson and the textbook, we noticed that the first risk factor of the breast cancer is gender, and that gender it is commonly among women, and not that men do not have breast cancer, but it's less than 1%. So it's commonly of women. That's what we have gender.
Group 8, we have to talk on the prevention of cervical cancer. And for what we learned that all types of cervical cancer are linked to HPV, that is human papilloma virus. So, and in order to reduce the chances of this HPV, we have to do it under 3 things. Number one is through lifestyle modification.
In a vote of thanks, the domestic liaison officer of the OCI Foundation, Mrs. Imelda Emeka, thanked the teachers, the resource persons, and the OCI team members for their various roles in kickstarting the AROI campaign in Anambra State.
Half of the OCI Foundation, some of you may not know the name. The full meaning is Onyebuchi Chris Ifebiora, a medical doctor based in Australia. I have to appreciate that man personally. It was in 2016 when I was in Otocha Zone. I got a call all the way from Australia.
Some officials of the OCI Foundation and the participants comment on their impressions of the Arm Ayos campaign. Doctors